For purposes of anesthesia, you typically would use a lidocaine, a novocaine, a bupivacaine. Your bupivacaine and sensor canes will give you approximately 4 to 5 hours worth of anesthesia. However, it will take about 10 minutes for those to actually settle into the tissues. Your lidocaine will go to work within 30 seconds to 2 minutes, but it will only give the patient anesthesia for about an hour to maybe an hour and a half. So depending on where the wound is, how much anesthesia you believe, and how much pain relief they will need for an extended period of time depends on what you want to use. Another good plan is to use a combination of the lidocaine or the bupivacaine so that you get more complete pain control, but you also get onset so that in your busy office you don't have to wait. We're using green food coloring just so that you can see the anesthetic parts that you should attach. We are also using a 30 gauge needle. The smaller the needle size as far as the injection into the tissues, the better coverage you're going to get and the less pain sensation that you're going to get to your patient. The green food coloring will show you the white blanching and the elevation of the wheal that you will hope to attain when you're doing your numbing and your anesthesia. Take the needle cap off, lay it off to the side. This happens to be a 1-inch needle. You can use the 1.5-inch needles if you're looking for a large amount of coverage, or you can use the shorter needles. Again, 27 to 30 gauge for actually injecting your anesthesia is better. You want to do it with the bevel up. You also want to go inside the wound, and you're going to have to explain to your patients why you're going inside the wound to give the anesthesia. Those nerve fibers have already been cut. If you're to poke through the skin again, they're going to get the pain sensation more increased than if you will actually go inside the wound. I typically will start towards one end of the wound. Get my extra suture material out of the way. Over to the side. You can use your forceps to do it so that your fingers are out of the way. You want to have bevel up, and then you go just under the tissue and start injecting. You will have a little bit of the green flow out at you, but you also start seeing that you're getting the green discoloration. You want to inject going forward as you're going, and then you can continue with the needle so that there's less pokes to the patient as you're going to the end. You then start on the other side with the same kind of technique, doing your first injection, pushing a little bit of the medication, and then you get an anesthetic effect as you move up the wound itself. We're going to get just a little bit more of the lidocaine. Again, with the lidocaine or the bupivacaine, on the average 70 kilogram person, you could use about 28 mils. For an average wound, you typically need about 5 or 6 mils in order to reach adequate anesthesia. Again, you want to see where it is. Go with the bevel up, stick it inside your wound, and get a good coverage of your green. I always want to go down to my ends. The ends of the wound are something that very rarely will take the anesthesia as well. And if I'm going to have my patient complain of any area of the wound that it hurt, it's going to be at the very edges. So after I've done the two sides of the wounds, I will come with my needle and go in again into the anesthetic area and just put a little bit of extra so that I'm sure that I have circumferential coverage around the edge of the wound. As you can see from this, as soon as I get my needle cap back on, again, no recapping of needles unless you have them laying down going like that in a safe manner. I now have what you will see is a white blanching and swelling. As you can see here, you have the green going around both areas of the wound with just a little bit of swelling. So then you wait for your 2 to 10 minutes, depending on whether you've used lidocaine or Marcaine. Come back. I will typically test with just using that needle a little bit just to make sure that we have good anesthesia or if we need to add any more to that point.